Measurable signs that you're improving include a stronger, uninterrupted stream, fewer trips to the bathroom at night, shorter time spent voiding, less urgency, and reduced post-void residue if measured by ultrasound. If any of these improve over days to weeks, you're on the right track. In clinic, we use a few straightforward tests to separate these causes. A urinalysis tells us if there's blood or infection. A urine culture identifies the bacteria when an infection is suspected and guides antibiotic choice. A focused symptom assessment and a physical exam, including a gentle digital rectal exam, help evaluate prostate size and tenderness. For more detailed assessment, we may measure post-void residual with a quick bladder scan to see how much urine is left after voiding, or perform a uroflowmetry test to quantify peak flow. PSA blood testing is sometimes done to screen for prostate cancer or to establish a baseline. It's not a direct test of urinary flow, but helps guide long-term follow-up. Importantly, the diagnostic plan is individualized. Not every test is necessary for every man. The key point is that identifying infection versus obstruction versus muscle dysfunction determines the next steps to improve flow. Let's move to treatments that most directly improve urinary flow, starting with what works fastest. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen or naproxen, can reduce inflammation and pain within hours to a few days and may make voiding more comfortable, especially in prostatitis or inflammatory conditions. If a bacterial infection is confirmed, appropriate antibiotics are essential and not optional. Antibiotics typically need to be taken for a longer course in prostate infections, often several weeks, because the prostate tissue is harder to penetrate than a bladder infection. The specific antibiotic depends on the culture results and local resistance patterns. This is a decision between you and your physician. Never self-prescribe antibiotics. For symptomatic improvement of flow in the absence of infection, especially with BPH, the class of drugs called alpha blockers is often the fastest-acting medical option. Medications, such as tamusolin, typically begin to relax the smooth muscle around the bladder neck and prostate within days, and many patients notice better flow and less urinary urgency in the first week, with peak benefit over several weeks. Alpha blockers can cause lightheadedness or dizziness, particularly when standing up quickly, so we counsel patients about this and start conservatively. For men whose prostates are significantly enlarged, 5-alpha reductase inhibitors, finasteride or dutasteride, shrink prostate tissue over time by blocking the hormonal pathway that drives growth. These medicines take longer to work. Many men won't see clear improvement until 3 to 6 months, and the largest benefits are often seen around 6 to 12 months. They are appropriate when prostate size is contributing to flow obstruction, and for men with repeated urinary retention episodes or significant enlargement. Possible side effects include reduced libido or other sexual changes in a subset of men, and these concerns should be discussed before starting treatment. If medications fail or complications develop, such as recurrent urinary retention, bladder stones, recurrent infections, or kidney problems due to back pressure, we consider procedural options. Surgical and minimally invasive treatments can be very effective at removing obstruction, but they are individualized decisions made only after discussing risks, benefits, and recovery expectations with a urologist. In clinic, I often tell patients that the fastest path to measurable improvement is a combined approach. Treat infections promptly when present, use an alpha blocker if BPH is suspected, manage pain and inflammation with NSAIDs short-term, and consider a 5-alpha reductase inhibitor when prostate enlargement is confirmed and longer-term improvement is desired. For example, Don Jesus came to see me with a very large prostate on exam and symptoms that had worsened over 2 years. We started an alpha blocker, discussed the likely timeline for a 5-alpha reductase inhibitor, and monitored his urinary symptoms and residuals. Over 3 months, his nocturia decreased and flow improved. He avoided surgery and reported feeling like himself again. But every case is different, and decisions about medication, duration, and whether to pursue procedural options are tailored to the man in front of me. Complementary measures can support these treatments, though they are not substitutes for antibiotics or prescription drugs when those are needed. Some supplements and foods have modest evidence suggesting they may ease symptoms or support prostate health. Saw palmetto extract is one of the most commonly used. Many studies show mixed results, but a typical standardized dose reported in trials is about 320 milligrams per day. Stinging nettle root, used in the form of root extracts rather than the leaves, has been used in doses roughly between 300 and 600 milligrams per day in supplement studies. Lycopene, the antioxidant concentrated in cooked tomato products like tomato sauce or paste, has been associated with prostate health benefits in some observational research. Incorporating cooked tomatoes into meals a few times a week is an easy, low-risk step. Pumpkin seeds are a source of zinc and other nutrients and can be a useful snack. Omega-3 rich fish, green tea, and turmeric or curcumin have anti-inflammatory properties and may help systemic inflammation. Expect to give supplements at least a month or 2, often 3 months, to notice any consistent benefit, and always discuss them with your doctor because there are interactions to consider and they can affect lab tests. For instance, some herbal products may alter PSA readings or interact with blood thinners. Supplements are adjunctive. They may help some men modestly, but they do not replace indicated antibiotics, alpha blockers, or surgery when those are needed. Now, practical lifestyle measures that directly influence urinary flow and daytime-nighttime comfort are often overlooked but powerful. First, think about fluid timing. If nocturia is your worst symptom, reduce large fluid intake in the 2 to 3 hours before bedtime while maintaining good overall hydration during the day. Avoid excess alcohol, caffeine, and spicy foods when symptoms are active. These can irritate the bladder and increase urgency. Break up long periods of sitting, stand, walk, or change position at least once every hour, especially if you have a sedentary job. Prolonged sitting can increase perineal pressure and pelvic floor tension, worsening symptoms. Pelvic floor habits matter. While pelvic floor strengthening helps many conditions, men with chronic pelvic pain or tight pelvic floor muscles often need relaxation and downtraining techniques rather than more Kegels. Learning to consciously relax the pelvic floor, practices you can do lying down or seated, focusing on slow diaphragmatic breathing and gentle letting go of the pelvic floor, can reduce pain and improve emptying over weeks. Sitz baths, sitting in warm, shallow water for 10 to 15 minutes once or twice daily, can reduce pelvic pain and spasm and make voiding easier. They're simple, inexpensive, and often underused. Regular sexual activity can help some men by promoting prostate drainage, but if ejaculation is painful or if you have an acute infection, avoid sexual activity until your doctor clears you. Let me give a practical example of how these pieces fit together. A patient in his early 70s noticed gradual weakening of his stream and increasing nighttime trips. He denied fever or pain. We checked a urinalysis and bladder scan. Urine was clear, but post-void residual was increased. I started an alpha blocker for quick symptomatic relief, advised him to reduce evening fluids and caffeine, suggested daily walks and taking a break from sitting every hour, and recommended cooking tomatoes into his meals and adding pumpkin seeds as a snack. We also discussed starting Saw Palmetto if he wanted to try supplements with a plan to reassess in 3 months. He noticed stronger flow within a week on the alpha blocker and fewer nocturnal trips after 2 months with the combined measures. The alpha blocker improved symptoms quickly, the lifestyle changes reduced nightly frequency, and the supplement was an adjunct he continued after discussing it with us. There are times when symptoms are urgent and require immediate evaluation. If you experience a fever higher than 101 degrees Fahrenheit, 38.3 degrees Celsius, severe perineal or lower back pain, nausea or vomiting, or suddenly cannot pass urine at all, seek emergency care. Acute urinary retention, when the bladder can't be emptied, may require immediate decompression with catheterization to relieve pressure and protect the kidneys. Also be alert for visible blood in the urine, rapidly worsening kidney function, or recurrent high fevers despite treatment. These are not situations to wait out at home. Now, let's dive a bit deeper into the supplements and foods some men ask about, with practical details. Saw palmetto extract is available in several formulations. The commonly used standardized dose in many studies is 320 milligrams daily of an extract standardized for fatty acids and sterols. Evidence is mixed. Some men report symptom improvement. Trials show varying results. Stinging nettle root extracts have been combined with other herbal extracts in some studies and are often dosed between 300 and 600 milligrams daily when taken as a singular supplement. Lycopene is best absorbed from cooked tomato products, so tomato sauce, paste, or cooked salsa, rather than raw tomatoes, and a reasonable dietary approach is to include a serving few times per week, which includes zinc and healthy fats. Omega-3 fatty acids found in fatty fish like salmon or mackerel may reduce inflammation systemically. Aim for 2 servings of fatty fish per week or discuss fish oil supplements with your physician. Green tea and turmeric or curcumin are anti-inflammatory additions with plausible benefit. Curcumin supplements often include piperine or special formulations to enhance absorption. Remember, expect any supplement to take several weeks to months for a potential effect. Monitor for side effects and tell your provider about everything you take so they can watch for interactions, especially if you're taking blood thinners or other medications. Because many people want concrete steps, here are clear, actionable measures you can start this week to work toward better urinary flow. Keep a simple bladder diary for 3 days, noting fluid intake, timing, and voids. Limit fluids in the 2 to 3 hours before bed. Reduce or eliminate caffeine and alcohol while you're symptomatic. Take short breaks to stand and walk if you sit for long periods. Try a twice daily sitz bath for pelvic comfort. Practice pelvic floor relaxation exercises. Lie on your back. Breathe deeply, and on each exhale, imagine letting the pelvic floor relax rather than tighten. And if you're being evaluated, ask your provider about a bladder scan and uroflowmetry to get objective baseline measures. If you're eligible and interested in supplements, discuss saw palmetto 320 milligrams day or nettle root 300 to 600 milligrams day with your doctor and plan to reassess in 3 months. When thinking about follow-up and prevention, proactive monitoring matters. Men with urinary symptoms should have regular follow-up to ensure treatments are helping and to detect any complications.
PSA screening is a separate conversation based on age, family history, race, and personal risk factors. We often establish a baseline PSA and monitor trends over time in men who are being treated for BPH or who have ongoing symptoms. If you're on a 5-alpha reductase inhibitor, expect PSA to decrease and make sure your provider is aware of that when interpreting results. If symptoms persist or worsen despite treatment, or if you develop recurrent urinary infections or episodes of retention, referral to a urologist for further assessment is appropriate. Imaging like ultrasound or more advanced testing may be needed in complex cases. Patients and families often bring multiple questions and misconceptions to clinic. Let me address a few common ones. First, antibiotics didn't help, so it mustn't be an infection. Not necessarily. Some prostate and pelvic conditions are inflammatory without a clear bacterial culprit, and antibiotics won't fix those. That's why culture-guided therapy and careful assessment are important before assuming an antibiotic approach. Second, if my prostate is enlarged, surgery is inevitable. Not always. Many men respond well to medications and lifestyle changes. Surgery is reserved for complications or for men who don't improve with medical therapy or who prefer a procedural solution after counseling. Third, supplements are harmless, so why not take everything? Supplements can interact with prescription drugs and may affect lab values. They're not risk-free and should be discussed with your provider. Finally, I've read about miracle cures online. Be skeptical. No single supplement or quick trick guarantees improved urinary flow. The most reliable improvements come from correct diagnosis, targeted treatment, and consistent lifestyle adjustments. Before you see a urologist or primary care provider, it helps to have a clear set of questions and information. Bring a short symptom diary showing how many times you void during the day and night, and any episodes of urgency or incontinence. Ask these questions. Is my condition likely due to infection, inflammation, or prostate enlargement? What tests do you recommend and why? If medication is prescribed, what is the expected timeline for improvement, and what side effects should I watch for? If I choose supplements, which ones are safe with my current medications? Under what circumstances would you recommend procedural treatment, and what are the options? How often should I follow up, and what objective measures will you use to track improvement? These focused questions help your clinician make a tailored plan and set realistic expectations. A few practical how-to details you can use right away. A sitz bath is as simple as filling your bathtub with a few inches of warm water and sitting for 10 to 15 minutes 2 times per day. If a tub isn't practical, there are portable sitz bath basins that fit over a toilet seat.
For pelvic floor relaxation, try this short exercise twice daily. Lie on your back with knees bent. Breathe slowly in through the nose and out through the mouth. As you exhale, consciously imagine the base of the pelvis relaxing and sinking toward the floor. Don't push or strain. Repeat 6 to 10 times. For diet, a sample day might include a bowl of oatmeal with pumpkin seeds for breakfast, a lunch with a tomato-based sauce and tuna or salmon for omega-3s, green tea mid-afternoon, and a dinner with a tomato-based stew and a side of steamed vegetables. Avoid coffee or energy drinks after late morning if nocturia is a problem. Small, sustainable changes like these tend to stick and accumulate benefits. Safety reminders are crucial. Don't assume that no pain means no problem. Silent urinary retention can damage the bladder and kidneys over time. Conversely, don't ignore severe pain or fever. These can indicate acute infection requiring urgent treatment. If you start a new medication and develop significant dizziness, fainting, worsening sexual side effects, or other concerning symptoms, contact your provider promptly. When starting any supplement, give it time to work and report any new symptoms or new medications to your clinician to check for interactions. To bring everything together, here is a short, practical checklist you can use as a launchpad. Recognize symptoms: weak stream, dribbling, incomplete emptying, increased nighttime urination, pelvic discomfort. Seek evaluation if symptoms are persistent or severe. Get a basic workup with urinalysis and a symptom assessment. If infection is present, accept that antibiotics are usually necessary and may require an extended course. For obstructive symptoms from BPH, ask about alpha blockers for quick improvement and 5-alpha reductase inhibitors for longer-term size reduction.
Add lifestyle measures like timed fluids, reduced caffeine and alcohol, movement breaks, sitz baths, and pelvic floor relaxation. Consider evidence-based supplements as adjuncts after discussing with your doctor, and follow up with objective tests such as bladder scans or uroflowmetry if symptoms persist. Measure improvement by a stronger stream, fewer nighttime voids, shorter voiding time, and lower post-void residuals on follow-up testing. I'll close with a few realistic reassurances. Many men who feel resigned to just living with it can achieve meaningful improvement. Some treatments bring relief within days, others take weeks to months, and combining medical therapy with lifestyle changes gives the best chance of restoring function and comfort. If you're embarrassed, know that urinary symptoms are extremely common and legitimate medical issues, not moral failings. If you or someone you care for is described here, start with a primary evaluation, a urine test, and a conversation about symptoms. If red flags are present, fever, severe pain, or inability to urinate, seek urgent care.
Otherwise, schedule a visit with a urologist if symptoms are persistent or worsening. That visit can give you a clear diagnosis, a targeted treatment plan, and measurable goals for improving your urinary flow. If this discussion helped you, consider sharing it with a friend or family member who might be struggling in silence. And if these symptoms describe you, schedule an evaluation with a urologist for testing and personalized care. You don't have to accept poor urinary flow as normal. There are stepped, evidence-aware approaches that can restore sleep, reduce urgency, and improve the quality of daily life.